The most common cause of cancer among women is the breast cancer. Yes. In fact, last year alone, more than 500,000 women died of breast cancer. This number would have been reduced if they had known the common causes of breast cancer or some of the things that will increase their likelihood of having breast cancer, which I'll be sharing with you in this video. I'm Dr. Akoche Omale, a licensed medical doctor. So let's dive right into the video. So please, at this point, please do not forget to like and subscribe. The number one on our list is called family history of breast cancer, also known as genetics or hereditary. That means if your mother has breast cancer, or if your grandmother has breast cancer, or if any of your siblings has breast cancer, then there's a high probability or high chance that you may also have breast cancer. So genetics is one of the risk factors, one of the things that increases your likelihood of having breast cancer. So one of the things that you do to kind of, prevent this is that if you are 40 years and above, then you need to go for what we call regular mammography screening for at least every 2 years. Mammography is a form of, an imaging whereby your breast will be examined, and then all the architecture of your breast, will be assessed to ensure that there is nothing going on. Yeah, this is so because breast cancer does not just happen overnight. There are some kind of changes, or formation that may be occurring in that place that regular screening will help detect those changes on time and then begin appropriate and prompt intervention. By so doing, it will prevent the spreading of the cancer and it will reduce the case fatality or the death rate. Yeah, the number two on our list is age. Yeah, age can also increase your chances of having breast cancer. So if you are 40 years and above, there's a likelihood of having breast cancer because most of the breast cancer cases we have had are in patients that are 40 years and above. But this does not mean that if you are less than 40, you cannot have breast cancer. Just that the chance of having breast cancer gets higher as you age. So if you're more than 40 years and above, please ensure you go for mammography. So please, at this point, please do not forget to like and subscribe. The number 3 on our list is called early menarche and late menopause. So I'm going to explain these two things for you now. Menarche is a commencement or onset of, menstrual cycle. Like when you start seeing your period, your menstrual period, that is called menarche. The menopause is the cessation of menstrual cycle. And this is when you stop seeing your menstrual cycle, like when it ceases completely, is menopause. Whenever you have early menarche, that is onset of menstruation, and late menopause, there's a high chance of you having breast cancer. Now, this is so because there's a hormone known as the estrogen. Now, the estrogen is a very good hormone, like it's a very wonderful hormone. It's a hormone that contributes to most of the femaleness of a woman, with breast development, pregnancy, and so many other things. Yeah, one of the things that estrogen does is that estrogen prepares and modifies or changes most of the cells of the breast, in preparation for pregnancy, menstrual cycle, and all those things. So now, at the cause of these changes, there may be some distortion that may result in breast cancer. So somebody that sees his or her menstrual cycle very early in life, let's say at the age of 8 years and above, and then somebody that enters menopause very late in life, maybe at the age of 48 down to 50, may have long-term exposure to estrogen. So this will kind of increase the person's chances of having breast cancer. The number 4 on our list is called obesity or overweight. And there's something that fat cells does. Now, one of the things that the fat cells does is that they secrete estrogen, the same hormone that is responsible for increasing the likelihood of people having breast cancer. So after menopause, the fat cells in the woman body may still be secreting the estrogen. This estrogen will be doing the same thing, like we're modifying and changing the cells of the breast, making them liable to mutate, which will eventually result in breast cancer. So one of the things that you do if you are overweight or if you are obese, please try to go, on a regular exercise. Try to watch what you eat to reduce the fat deposits in your body. By so doing, you reduce the likelihood of you having breast cancer. Yeah, the number 5 on our list is called alcohol consumption. So people that take alcohol, even at high or little doses, can result in them having breast cancer. Now, the chemical in alcohol, also known as ethanol, has the ability to directly damage the DNA of the cells, making them liable to mutate or to transform and grow excessively without the body's control, resulting in cancer formation. So if you are the kind of person that drinks alcohol, one of the good things that you do for yourself is to quit alcohol entirely because it will increase your likelihood or your chances of having breast cancer. Yeah, the number 6 on our list is prolonged exposure to radiation, such as X-ray and some of these gamma rays. It may not really be the patient's fault because the patient may have a particular chest condition whereby the patient may have to go for chest X-ray for one or two reasons, for investigation. Now, there's something that the X-ray or most of this gamma ray does. The breast is a very soft tissue. So this X-ray has the ability to penetrate the breast and at the same time damage the DNA of the cells, which may eventually result in their mutation and then will eventually result in cancer formation. But the good news is that most of our radiologists understand this. So whenever they're about to do a chest X-ray for a lady, they don't tend to expose her for too long. But if you have had several radiation or prolonged radiation to the chest, then it may increase your likelihood of having breast cancer. Yeah, the number 7 on our list is lack of physical exercise, also known as sedentary lifestyle. So if you're the kind of person that is very inactive, just sleeping on the bed, eat, do 1 or 2 house chores and all those things, then there's a likelihood of having breast cancer, because with lack of activity comes obesity, like increase in the fat deposits in your body, which will eventually result in secretion of estrogen. So if you're the kind of person that is inactive, then you need to like buckle up and try to exercise regularly. By so doing, you burn most of these fats. The number 10 on our list is called smoking. The chances of breast cancer in somebody that smokes, in a lady that smokes, is 5 times higher as compared to a lady that does not smoke. So smoking, especially tobacco products. Now, tobacco has some components, some substances that tend to cause damage to the cells of the breast, which will eventually result in mutation and then breast cancer. So either smoking or vaping will greatly increase your chances of having breast cancer. So please try to quit smoking. So I just want you to remember that having any of these causes or the risk factor that I've mentioned earlier does not translate to you having breast cancer. Rather, it just increases your chances of having breast cancer. You understand? I just want you to understand that with appropriate lifestyle modification and regular medical checkup will greatly reduce your chances of having the breast cancer. So one of my advice to you is that if you are above 40 years of age, please ensure you go for mammography every 2 years. By so doing, if there's any changes in your breast, it can be easily detected and then there'll be prompt intervention to save your life. So thank you for your time. I really appreciate you. Please do not forget to like and subscribe. And I also want you to share this video to your loved ones. You could just be saving their life. Thank you for your time, and may the Lord bless you.